Welcome back to Good Morning San Diego. Today is Melanoma Monday, which officially kicks off Skin Cancer Awareness Month. Here to share some tips on how we can care and protect our skin during these bright sunlight days is board-certified dermatologist Dr. Melanie Palm. Hey, Dr. Palm, how are you doing?
I'm doing good. I miss seeing you guys in studio, though.
Absolutely. It won't be long. Let's talk about the conflicting information that we are now getting. Everyone's saying, oh, man, we need our vitamin D to fight COVID-19. I'm sure you agree, but within reason, right? We don't want to go out and cook ourselves in search of vitamin D.
Absolutely. You know, I even wrote a blog entry on this. I think everybody should be getting our vitamin D, but I think if you ask any board-certified dermatologist, we want you to get it through your diet and supplementation and not use it as an excuse to really shake and bake on, a sunny day, which we're getting lots of this week here in San Diego.
You know, I used to be a youngster once, and I used to lay out in the sun. I remember all the terrible things we did, like oil and whatnot, to get that deep brown tan that everyone thought was so good. Bottom line, all of that is not to be done, correct? We shouldn't be doing any of that?
Yeah, so we really wanted to bring awareness to the KOSI viewership and let them know today, May 4th, is Melanoma Monday. This year alone, there'll be 5.4 million cases of skin cancer, and 105,000 cases of those will be melanoma, which is what we get really concerned as dermatologists as being the most lethal. And so we know that a strong propulsor of melanoma and non-melanoma skin cancers is cumulative and really bright intermittent sun exposure. And, although the weather is turning amazing and a lot of us are socially distancing and doing some things outside responsibly, a lot of us are still indoors. And I think we really need to take note of that, because even if you're next to a window and you think you're safe inside, the UVA rays are actually coming in. And that is the spectrum of wavelengths of light that we get really concerned about with melanoma. So certainly we want you guys to wear sunscreen. There's really awesome applicators, like this is a brush one, all your creams, lotions, gels. Make sure that they're broad spectrum. Make sure that they have zinc or titanium in them, and make sure you're reapplying it. If you're going to be out for a longer period of time, you need to reapply every 90 minutes. But I think the biggest thing is early detection. Last month, despite us being under orders and shelter at home, I had 2 melanoma cases. And so melanoma does not wait on COVID. And if you have something really concerning and changing, we want to see you.
All right. So what should we be looking for when we're doing our self-examinations?
Absolutely. The biggest thing is the ABCDEs. So this is one of the melanomas that I diagnosed and treated. And you see asymmetry at the border. The border is irregular. The color is very dark, or if you see multiple colors, including white or blue. If the diameter is larger than 5 or 6 millimeters, this is another melanoma. And then the biggest thing is E, which was added a few years ago, and that means evolution. So if you notice something evolving, meaning it's changing, it's itchy, it's painful, it's the ugly duckling, it doesn't belong, doesn't look like the rest of your spots or the rest of your moles, please make sure you're getting it checked out. Just wanted to show you, melanoma scars don't have to look bad. This is one of my patients about a year out from a melanoma on a lower extremity, but it is, they can look quite subtle. So that's really, I think, why people, especially if you're high risk, if you've had a skin cancer yourself, if you've got a strong history of a family history, somebody's been touched by melanoma, make sure you're getting a really good skin exam by a board-certified dermatologist.
Well, Dr. Palm, a mark on your skin or whatever scar is left over is nothing compared to to death. I mean, if not treated, these things can be fatal, correct?
And that's what's concerning. Melanoma can look like a little spot, and it really is lethal. And long-term prognosis and long-term survivability is really related to the depth of the melanoma. And when we catch melanomas very early, which most of those were very early on that you were seeing photos of, it's almost 100% cure rate or survivability. 5 years out, 98 to 100% of patients are alive. But if you let something persist and you ignore it, then something that doesn't look like that big of a deal can be lethal. And so we really want people checking themselves. If you get that spidey sense that something is off with one of your spots, please go and get it evaluated. I wish we could do virtual biopsies, but we're not quite there yet. And so we actually do need to see you in clinic. But I will tell you, dermatologists in San Diego are amazing, and we're doing everything we can and abiding by CDC guidelines to make sure our patients and our staff are very safe while we're doing these exams.
Dr. Melanie Palm, we're going to leave it there. I'll post all this on our website once I get done with work today, okay?
All right. Thank you so much.
All right. Sunblock, everybody. Hats, everybody. Keep your exposure to the bright sun on a limited basis. All right. More San Diego City